The Star Trek program is a comprehensive adolescent health program. We do everything from the early identification of young folks at risk for HIV and living with HIV to primary care. We have multiple components. Some of that includes a lot of what we do in the community, which is the health education, the testing for HIV and other STIs, and then a lot of what we do is the medical care. So we have a couple of clinics. We have clinics for folks who are at risk for HIV, folks living with HIV, transgender specialty clinics, and our family planning clinic. So that's kind of the core of our medical services. And then we provide capacity building for other agencies interested in serving similar populations.
So Star Trek is huge and their arms reach out pretty far, and we actually are just moving towards being statewide now. So we're going to be going around to different other counties outside of Baltimore and doing the same things that we do here in Baltimore.
I think the things that make our program unique is that one, and particularly for our prevention and outreach teams, we hire directly from the community. We hire people that look like, sound like, speak like the populations that we serve. So I think that gives our program a different perspective as when we're planning. Part of our work is actually consistently having conversations and analyzing our own privileges, analyzing how we show up in spaces, making sure that our work is not ageist and making sure that we're not dismissing the thoughts of young people.
We do see everyone and anyone. For most things, we throw a lot of different events as well for the LGBTQ community to bring awareness to HIV, stigmas about HIV, advocacy, to bring awareness to different things like PrEP, pre-exposure prophylaxis, like preventative measures.
It's not effective to do the same models of we're going to come and talk to you about HIV and that's it. So what we like to do is make sure that we are creating a safe environment and a fun atmosphere to learn about things, learn about health, but then also learn about different aspects of sexuality, or learn about different aspects of just fun and communication. And so I think that's how we frame our work. So particularly after we do our events, typically we see an increase in the number of people who are coming into our program to get tested or to get screened for PrEP or to get linked to HIV care. It really is an opportunity for people to hear about us, to have people see us doing this work in a fun way, and then having that translate to people coming in and feel safe enough to talk to us about some of the challenges they're facing.
So another thing that we do is we have an X-Gen group where we go and get youth from the community who haven't worked before or may have worked but haven't had a real job, and we bring them in and we do training. So we're training the youth to be able to advocate for themselves and advocate for each other.
My experience there was just as vigorous as it is for them now. There's a lot of things that was new to me, a lot of things about myself professionally I had to fine tune, and through that program I was able to do so. Also, I was able to connect with so many great people within public health, within Baltimore City and all over the country. Had so many opportunities to do public speaking about issues, and I think it was more effective when I was younger to speak on major issues such as the HIV epidemic, the homeless epidemic, and things of that nature, because it was coming from someone that was adolescent, and actually these were the services that you were trying to go ahead and administer to us as adolescents, so it was more believable.
I think programs like this are important to have because there's so many adolescents and just people in the LGBT community, period, that really need this stuff and don't know how to get it. And Star Trek's direction that we go in is pretty much the way to go. Because we approach it in a more realistic way, something that you see on an everyday basis versus something that you're afraid to approach.
I think so many times adolescents and young adults are being told what to do and no one's actually listening to them. And our program is the program that listens and helps them then make the decision that they feel is best for them. It's not about what we want for them, it's about what they feel is best for them and us supporting them and getting there. So I hope future generations are able to find out where we are and come to us and get the support that they need. And I also hope that through our work, we're able to continue to inspire other young people, particularly from marginalized populations, and to definitely create a new generation of public health experts who are grounded in similar principles of Star Trek, who are doing amazing work.